You know, when the government told us late last year that they'd begun securing agreements for various COVID-19 vaccines, and the plan was to seek TGA approval in January before rolling out the first of what could be several vaccines in the month of March 2021, there was this overwhelming feeling of optimism that we were somehow getting somewhere. Now, the feedback here and on radio was certainly approving of the plan. And as the UK and the US received their emergency approval for a rollout, again, the reaction here was positive. The public, like me, was quite relieved that the UK were about to become the international guinea pigs, and we had the distinct advantage of watching the outcome, the rollout difficulties, if there were any, and of course any new side effects that would arise over several months. A perfect setup for Australia until a small spike in cases pre-Christmas brought the Nervous Nellies out of the woodwork. All of a sudden, a section of the mob wanted the vaccine now. You've read them, you've heard about them, you've seen them on social media. Where is our vaccine? Chief among those Nervous Nellies was opposition leader Anthony Albanese, who was again looking for some spotlight after a year very much in the shadows. Even yesterday, he was demanding an approval pronto and an instant rollout.
What we know is Australia is not at the front of the queue. We've never been at the front of the queue, and that's why Labor argued very early on that we needed to get these deals signed, that we needed to get 6 deals signed, which is international best practice. And the fact is that other nations got to the front of the queue way back in March of last year, and Australia isn't at that point yet.
So let's analyse that. Here is a bloke insistent that a wealthy country like us, with the world's best health system and infinitesimal infection rates compared to the rest of the world, it's true, should jump the international queue, should jump the queue above the UK, above the USA. Where's his care, for instance, for third world nations who have no reasonable chance of controlling the spread of the virus? What about their critical needs first? Oh no, we need a vaccination down under. We should have been at the front of the queue. The medical facts are these: we are not in any critical need. There's not one Australian in an intensive care unit at the moment. We have more than 7,500 ventilators sitting idle. The virus has only returned because of overseas travellers. It's been wiped out from most of Australia. And as infectious diseases expert Professor Peter Collignon told me here last night, we must briefly wait and can learn so much more.
But at the moment, we have the luxury of, first of all, seeing what happens in those countries when they roll this vaccine out to millions of people, because that's another safety component. But secondly, to make sure we get the full data from these companies to make sure it is efficacious in all age groups, not just in the 18 to 60-year-olds predominantly, but also that the side effects, there's no rare side effects. But more importantly, rolling it out in an effective way, in a safe way, particularly because these are going to be multi-dose vials, is just as important as actually getting the approval.
I just thought it was so important to replay what he said last night, because when it comes to what advice you follow, I'd be following Peter Collignon well before I'd follow Anthony Albanese, wouldn't you? And what's of paramount importance on the subject of vaccinations is that this mammoth process is done efficiently and successfully. Vaccines without large-scale stage 3 trials should not make the cut. Already, an Indian company is seeking approval without those trials completed. That doesn't impact us, thankfully. But if we get this wrong, not only will very few people take the jab, and therefore in this country we could face the perils of the virus for decades to come, but we can then ruin the public's faith in all kinds of life-saving vaccines, from tetanus to polio and everyone in between. That would only recreate the disease disasters of previous generations. We can't have that. No. We've got to hold our nerve. That's the most important thing. When clusters occur, as Sydney has now, the unravelling of Barella, which is only up to double figures, up to about 18 at the moment. Don't get panicked by these small spikes in the virus. We've got to calm down. Trust the plan for 2021. we'll get access to vaccines from March. And for a nation in such a fabulous position in terms of fighting COVID-19, that's not all that far away.